Welcome to This Explainer. I'm a physician assistant specializing in urology, and today we're jumping right into a topic that's incredibly critical to men's health, but let's be honest, is often surrounded by a ton of confusion: prostate cancer screening. We're going to figure out how to make the right choice for you. So, let me ask you straight up. Are you a guy between the ages of 45 and 70? If you are, you've probably heard plenty of conflicting advice out there about whether, or actually when, you should get tested. And hey, it is completely normal to be unsure about this whole thing, which is exactly why we're breaking it all down today. Okay, to really understand screening, we've got to understand the test itself. So your prostate is this little walnut-sized gland right below your bladder, and our go-to screening tool is a simple blood test that measures something called PSA. That's Prostate-Specific Antigen. Basically, it's a protein made by the prostate, and when those PSA levels come back high in your blood work, well, that acts as a warning sign that something might be disrupting the gland. And honestly, this test matters a lot. Prostate cancer is actually the second most common cancer in American men. To put that into perspective, about 1 in 8 men will receive a diagnosis at some point in their lifetime. That's a huge number. So the whole goal of screening here is simple. We want to find the aggressive forms of this disease early, right when they are the absolute most curable. But here's exactly why it's not just a straightforward yes or no decision. You see, prostate cancer is often incredibly slow growing, like very slow. And this creates a major medical challenge that we call overdiagnosis. That means finding a cancer that literally would have never caused you any symptoms or health problems in your entire lifetime, but the catch is the actual treatment for that cancer might cause you severe harm. So we have to weigh these trade-offs really carefully. On the plus side, obviously, screening saves lives by catching fatal cancers early. That's a massive benefit. But on the harm side, well, a high PSA doesn't always equal cancer. It could be an infection or an enlarged prostate. These false positives lead to a lot of unnecessary worry and sometimes invasive biopsies. Plus, treating a slow-growing cancer comes with the risk of some seriously life-altering side effects. We're talking about things like urinary incontinence or erectile dysfunction. Section 7. Personalizing the risk. When should you start? Because of these profound trade-offs, there's just no blanket rule that applies to everyone. We really have to personalize your risk. So when exactly should you start thinking about this? While the guidelines out there can vary a little bit, the overall medical consensus is super clear. Your timeline has to be tailored to you. For men at average risk, you should really start this conversation with your provider right around age 50. But if you fall into a high-risk category, you need to act a good bit earlier, typically around age 40 or 45. Now, you might be wondering who actually falls into that higher risk category. Well, the data shows us some pretty severe health disparities. For instance, Black men have a nearly 60% higher incidence of prostate cancer and a staggering 2 to 3 times greater mortality rate. That makes early screening absolutely vital. You're also considered higher risk if you have a strong family history of the disease or if you have known genetic mutations like BRCA1 or BRCA2. Now, if you do decide to screen and your PSA comes back elevated, first thing, do not panic. It is no longer this automatic scary jump straight to a biopsy. Nowadays, we use a much more careful multi-step process. First off, we just repeat the blood test after a few weeks to see if things normalize. If it stays high, then we bring in advanced imaging, like a prostate MRI. And it's really only if that scan shows something highly suspicious that we'd actually proceed to a targeted biopsy.
And I've got to say, modern MRI technology is an absolute game changer here. It creates this incredibly detailed visual map of the whole gland. What's amazing is that a negative MRI might actually allow you to safely avoid a biopsy altogether. That drastically reduces your risk of infection and saves you from a totally unnecessary invasive procedure.
So, navigating all of this really comes down to one core concept: shared decision-making. Think of it as a professional, two-way conversation with your doctor. It's about combining the absolute best medical evidence we have with your personal values, your health priorities, and your life goals, just to find the exact right path for you. Because at the end of the day, there is no single right answer for everyone out there. There's only the right answer for you. So I want to leave you with this question: what is the right answer for you? I really empower you to take control of your health journey. Schedule a conversation with your provider today, and let's find out together.